hospice sector in Scotland is under severe and growing financial pressure, with 2/3 of hospices making cuts or planning to do so in the near future. This is due to underfunding that's left hospices stretched to breaking point, with many being forced to cut services at a time when they are needed more than ever. Nowhere is this reality clearer than in my constituency of West Dunbartonshire. My constituency is home to Scotland's oldest and largest hospice, St Margaret of Scotland Hospice, and Chas Robin House, which provides specialist care to babies, children and young people with life-limiting conditions. I note the findings of the Independent Palliative Care Commission, and I strongly support its call for a comprehensive specialist palliative care service that is properly funded, accessible to all and available from the point of terminal diagnosis or advanced chronic illness. That vision reflects what families in my constituency need and deserve. St Margaret's has served generations of families in West Dunbartonshire and beyond, and I want to thank the formidable and irreplaceable stewardship of Sister Rita Dawson and her team of wonderful staff and volunteers. St Margaret's is currently undertaking a £6 million refurbishment project, and this work is almost complete, but there remains a funding shortfall. So far, all of the money has been raised through donations and fundraising efforts. Modernisation is urgently needed to ensure patients receive care in dignified, therapeutic surroundings fit for the 21st century, yet the hospice continues to face a funding gap. At the same time, Robin House provides extraordinary children's palliative care to families facing the unimaginable. Its services embody precisely what the Commission describes: holistic, speculative care that extends beyond the patient to the whole family, including bereavement support. But like adult hospices, it relies heavily on charitable income alongside statutory funding, and that does not always reflect the true cost of delivery. I understand that the findings of the Commission are related to England specifically as part of the Government's 10-year NHS plan. I welcome the fact that the UK Government has committed significant investment in hospice and palliative care services in England as part of our long-term health planning. That funding recognises that palliative care is an essential part of our healthcare system for those receiving end-of-life care and their families. But having spoken to representatives from hospices in West Dunbartonshire, it is clear that there has been very little indication of help which was promised under the Scottish Government's palliative care strategy announced last September. Hospices in my constituency are struggling. They deserve clarity and transparency on where this much-needed funding is. West Dunbartonshire has some of the highest levels of health inequality in Scotland. That makes equitable access to specialist palliative care even more critical. A postcode should not determine the quality of someone's final months, nor should hospices be left dependent on community fundraising to complete essential building works, while additional public funding sits elsewhere, somewhere in devolved budgets. So I ask the Minister, given the capital and revenue investment announced for palliative care in England, has she held discussions with her Scottish counterpart to ensure that Barnett consequentials are properly reflected in Scotland's approach to hospice funding? In particular, will the Scottish Government set aside their Barnett share of the capital for hospice building improvement works announced by this UK Government, and will she commit to continuing engagement to ensure the vision set out by the Independent Palliative Care Commission is realised not just in one part of the United Kingdom, but across all of it? Thank you, Madam Deputy Speaker.